All right. Good evening, everyone, and a very warm welcome to all of you for joining us from different parts of country and beyond. Today, I'm Dr. Mansi, proudly from BGen Publishers, and it is my privilege to host today's webinar organized in collaboration between Homeopathy 360 and Mission Homeopathy. Today marks a special occasion as we begin the first session of our academic webinar series under the banner of Homeo Mission 2026. This initiative has been thoughtfully designed by Mission Homeopathy with the objective of promoting genuine classical homeopathy and sharing practical clinical wisdom inspired by the thoughts and teaching of Dr. Amar Singh Nikam sir. The vision of Homeo Mission 2026 is to create a platform where clinicians, teachers, and students can come together to learn, discuss, and strengthen their understanding of classical homeopathic principles through authentic clinical experience. And today we are very honored that today we have Dr. Amar Singh sir and Dr. Manish Nikam sir they are also present in this session. And today's webinar features a fascinating clinical presentation titled A Pediatric Case of Protein Losing Enteropathy, Journey to Similimum Through a Fascinating Case Study. And this topic promises to take us through a challenging pediatric case, highlighting the process of case analysis, evaluation of symptom, remedy differentiation, and much more. And today we have our very talented speaker, that is Dr. Rahul Jadhav sir. We also had the session with Dr. Rahul sir earlier, and that session was also very insightful and was very beneficial for all the learners. Today, I'm going to introduce our speaker today again. And Dr. Rahul sir is a dedicated practitioner and passionate student of classical homeopathy, known for his thoughtful approach to case analysis and his commitment to clinical excellence. Dr. Jadhav is a leading classical homeopath with over a decade of clinical practice across Satara, Karat, and Pune, renowned for his inspiring and clinical rich teaching. He is a sought-after speaker who has conducted numerous seminars across Maharashtra and an international clinical workshop for European homeopaths. He actively promotes evidence-based classical homeopathy through regular academic sessions, and he is popular for the Case of the Week series on social media. And today we are going to learn about a very complicated case through a case presentation which is on protein losing enteropathy. So I would like to hand over the mic to Dr. Rahul sir, and thank you so much sir for managing your valuable time for arranging this session, and we all are very eager to learn from you.
Thank you so much, Homeopathy 360 and the enthusiastic coordinator, Dr. Mansi Tyagi. As I am talking here, I am just representative of our team, that is Mission Homeopathy, a team inspired by the thoughts, teachings, and visions of legendary homeopath Dr. Amar Singh Nikam sir. It's my honor that I have been selected as the first one to present this, but this is what I can say. This is just a trailer. More experienced and more enthusiastic homeopaths will be presenting every week. And I'm sure that this case series is going to be one of the most practical clinical webinar series in the field of homeopathy. So here I will also like to request you to make Dr. Manish Nikam host, so that first of all, Dr. Manish sir and Dr. Amar Singh Nikam sir, who is we are fortunate that he is here today. They will tell about our team, our visions in brief, and then we will go for my case discussion. Thank you, Dr. Mans.
Definitely. So, of course, so I have changed the role of Dr. Manish Kumar Singh Nikam sir is now our panelist, and he can share his thoughts or views on this series that we are going to have today.
Okay, good evening, everyone. So it's very wonderful to see you all over here on the platform of 360. First of all, thanks to Homeopathy 360 for making a collab with Mission Homeopathy team and yours. So it's an like as we know, Dr. Amasya Nikam sir is practicing since more than 40 years, and
Yes.
we here at Aditya Homeopathic Hospital we are treating lots of critical cases, acute cases, and the live IPDs also. So we thought we should share these things, share our knowledge to everyone all over the world, and uh, Homeopathy 360 is a great platform for that. So thanks for that. And yes, we are starting our new series, new web series, and these series only with sir students. They will present their cases. They will present their experience in the classical homeopathy. Basically, Mission Homeopathy is nurturing and caring of the classical homeopathy organization. So what we do is where we can help our patients, even our students, with the classical homeopathic approach. We tell them our approach, our understanding of homeopathy. And as you all know, sir's practice is totally depends on the single remedy, single medicines, and with mostly he's treating with the 30 potencies only. So that approach, everyone should understand how we are treating such kind of cases. So we thought of to start with the new web series, and these webinars are only for that thing, that purpose only. So we have Dr. Amasya Nikam sir with us.
Hello
and
everyone.
I would like to share, sir, please share something. Yeah.
Very thankful to Vijay and Publication for always a helpful word. Never says no to any Buddha. And this is a very beautiful thing. This broadcasting is reaching towards every homeopath home. Homeopathy is a science. She is truly based on the philosophy. We'd like to share our cases, our particular cases, crucial cases for this seminar. And I also congratulate to Dr. Rahul Yadav for Rahul for selecting first time introducing Mission Homeopathy seminar in this world. Thank you very much.
We have a great team. We are almost 17, 18 doctors will be there for such a wonderful journey. And every week, every Friday, we will host this session. And I hope the audience will like it. Before starting this session, I would like to introduce about Dr. Amasya Nikam sir and Aditya Homeopathic Hospital. So I'll share my screen for a few minutes. My screen is visible.
Yes, sir.
Yes, it is visible.
Okay, great. So this is our hospital, Aditya Homeopathic Hospital and Healing Center. And you all know Dr. Amasya Nikam sir. He's an MD homeopath. He's a founder and director of this hospital. So he started his practice with just a small OPD, and he is very well known for the treating patients with critical patients even with minimum potency of 30. And no adulteration, no mix, nothing, only single remedies. So this is our hospital. This is our current endeavor. You can see it is of 9 floors, and 8th floor is only for the hospital. We having our own ambulance, a good corridor. This is canteen, and the patient lift, stretcher lift is there, and this is corridor on each floor. So very spacious. And this is Sir Dr. Amar Singh Nikam in his cabin. Dr. Suchitra Nikam, my elder sister. This is myself, Dr. Manish Nikam, and my Mrs. Dr. Manaswi Nikam. So we all four are running this hospital. And this is Sir while taking rounds with the students in different ward. This picture is from general ward. There's a male general ward. Then also we have a homeopathic ICU also. And there are lots of facilities we are providing with this hospital. As hospital, it should run for 24 hours. So we are open for all the times. And we are having almost 100 beds, all diagnostic tools. Also, we are running internship training programs and the other courses too. We also have with our student those who are going to have lecture series of this with Homeo Mission. So they conduct homeopathic workshops also. And Sir is also having many conferences and seminars at national and international levels. And not only that, we conduct many free medical camps. For an example, yeah, even there is a picture of an animal. So we had 3 animal camps also. And this is from Amarnath Yatra. So you can see over here. And so many camps. We had treated lakhs of patients in these camps. And all those patients had been treated with free medicines. And not only for that day, but the consultation and even the lifetime medicines will be free for them. So even some pictures of this is from the Bastar area even. This is another animal camp. This is 3rd animal camp. So even seminars, yes, many places from cities, from states, from national to international, everywhere. So this is from Lucknow, then Patiala, and Singapore. So he is very well known internationally, and also with BGen also we had our book Vital Force is Oxygen that has been published in BGen only. This was seminar in Mumbai. The lectures for institutes at various places. So I'll go forward. And books written by him, Dr. Amar Singh Nikam. So these are the first 2 books. Then these first 2 books are for the cases. Homeopathic Hospital, yes, and Homeopathy, the Art of Rapid and Gentle Healing. Then the Manifestation of Miasm. On the miasms also we have our book. On Thermal Materia Medica, after Gibson Miller, there is no other doctor who had researched on the Thermal Materia Medica. Sir did that. And yes, Vital Force is Oxygen. This is what I'm talking about. This is published in BGen, and we had published in Poland. That this is for Marathi Muslim. So homeopath Kahawa, this is for the layman, and this Magnificent Healing by Homeopathy in Critical Cardiac Disease. This is launched through CM of the Maharashtra at that time in the year of 2018. And recently in 2024, we had published our another book in Spanish language in Spain. This is La Homeopathia. That cardiac book has been translated into Spanish language. And also COVID-19, also we had our COVID book. So many awards and felicitations at the national and international levels. So he is very well known for that. And the honorary awards, this is from the Zee Marathi channel. The Maharashtra Council of Homeopathy, MCH, also have given the awards, and this is very prestigious. This is Lifetime Achievement Dr. Samuel Hahnemann Award. This he got in the Germany, Togo, where Dr. Samuel Hahnemann had born. So at that place, he achieved this awards. And this is the article which has been published in the Spain. And this is of 10 pages article in Spanish language. And also he is very well known, and he is awarded for founding father of homeopathic hospital. And yes, we have many celebrities, many guests, many politicians, actors, actresses. Those are our patients. So very well-known faces from the Maharashtra, nationally, internationally. Some actors, actresses are there. This is Ajay Atul, famous musician, Johnny Lever. This is Marathi actress, and very well-known personality, but nobody knows him as an many had not seen his face. He is Dr. D.Y. Patil sir himself, who is taking homeopathic treatment. And not only that, we worked in the sports also. So Zahir Khan, the Indian pace bowler, was our patient. And sir has been elected as an Indian team sports doctor in the year of 1991. So the handicap tournament, which was internationally conducted. So not only this, these are reviews from the many celebrities. And yes, the CM of Maharashtra, he had inaugurated our new hospital in the year of 2018. So many celebrities and many people were there, many politicians, and Dr. D.Y. Patil sir was there, Naik sir, Ayush Minister was there, and many MPs were there. So there is some speech about Dr. Amarsiya Nikam sir and Aditya Homeopathic Hospital by CM of Maharashtra, Devendra Fadnavis sir. You can see it on YouTube. Also, sir has produced the first film in the homeopathic fraternity and produced by Amar Aditya Production, which was Pratisad, the response. This film was launched in the year of 2010, and this was launched in the 60 theaters of Maharashtra. And not only that, it got awarded in the Tokyo also, and very famous Dadasaheb Phalke Award also we got from this film. So very good film that is also available on YouTube. And this is just a few brief things about Dr. Amarsiya Nikam sir. There are lot many things to tell, but today's topic we have to cover, and this is just an a motivational thing. So I've shown you, and I request Dr. Rahul Jadhav, you can start your session. And before starting, sir had good idea about, sir, we just discussed that we can have such kind of good sessions later on also. So we will plan accordingly. We'll see the response of these sessions, and then we have a good future plans with either Homeopathy 360, even individually also. And currently we are running so many courses in our hospital right now. As I said, internship program and the classical homeopathic workshop, those are also there. So let's begin with these things. And this is our good opening batsman, Dr. Rahul Jadhav sir. So he can start a good inning, I guess. So well wish to everyone. I will be also part of these sessions. So good to see you all. Thank you. Thank you, everyone.
Thank you so much, sir. And we are very grateful to have you both with us. And it's our we are very lucky that in such today's time, Dr. Amar Singh sir has done so much for the homeopathic fraternity, and we are very blessed today that we are going to have this session. And I would like to
Thank you.
hand over the mic. So please begin.
Thank you, madam. Thank you.
Thank you, Dr. Manish sir, and Dr. Amar Singh Nikam sir is here actually. I am really nervous now because he's my mentor, teacher, and everything. Whenever we see sir, we have with we are speechless basically. See, I have seen this introduction multiple times, okay? But every time I see this introduction, the shiver goes through my spine because each and every slide that Dr. Manish has shown now is amount of work that what we are doing actually is just a tip
Yes.
of ice tip
Yes, sir,
as
definitely.
compared to this Dr. Nikam sir's work.
Yes.
And here I felt that it is our responsibility to take his message to the world, that such a simple, such a easy to practice method that Dr. Nikam sir has established after years and years of practice, not day, but day and night, literally day and night of practice. You must be knowing, or right now there are more than 328 attendees here. So they must be knowing that Dr. Nikam sir's OPD time used to be from night 9-10 p.m. whole night till morning 6-7 a.m. That ran
Right.
for more than 15 years.
All right.
So this is just one example, hundreds, because if I start talking about my guru, this 1 hour session will be really short. But as I have given this opportunity and I am blessed to have this opportunity to present my case in this Homeo mission, where we will be spreading the word of Dr. Nikam sir's teaching. Without wasting a single minute, I'll start my session.
Yes, sir, sure. Please begin. And we are also very blessed to collaborate with such great personalities. And we see in the slides that no doubt, definitely, Dr. Amar Singh sir has done a lot for this homeopathy fraternity. Even opening such a brilliant hospital and having lots of ICU OPDs and having beds for patients. It is these works are really marvelous, and we are very happy to promote homeopathy on this platform today. So please begin.
Yes.
So your two images are showing on the screen.
Okay. Two images.
Yes.
Means PPT, the background.
Yes, we can see the PPT and
Myself
we
in
can.
the corner.
Yes,
Yeah.
you are coming on the corner also and from
Okay.
the image also.
Why is it happening? I should stop my video now.
Right, sir. No, sir. You can keep your video on,
Just
but
okay.
you are appearing in two places.
Okay. Now I have stopped the sharing. Okay. Now I'll start my sharing again.
I guess there is an option in your PPT.
Just a minute. Right now sharing is off, right?
Yes, yes.
Yes. Now entire screen. What's happening now?
Sir, again, you are appearing at two places.
Okay.
Can anyone from the audience, can you confirm?
Yes. Anybody from audience, Dr. Vishal or someone? What's the screen exactly showing?
Yeah, Dr. Rahul, you can begin with these things. No issue.
Okay. I think from your side, host it's showing twice.
All right, sir. No issues.
Just a minute. So right now there is a screen.
Yes. And you are in the front of screen.
Front of the screen.
in the corner. You are in the corner.
Not twice.
No, not twice.
Okay, okay. And though I'm in the corner, the slide is pretty visible.
Yes, sir. Yes.
Okay. So as I've said earlier, that I am just part of this wonderful team, which is established by years of hard work by Dr. Amar Singh Nikam sir. You can see these all are, I can use Hindi word, Dhurandhar homeopaths who are practicing across the India, and the individual has fascinating, amazing practice. So I'm fortunate here that got chance to be the first one to present case. Those more than 300 people are here. I'll request them that each Friday, please spare your this 9:30 p.m. time. You'll be learning a lot more than those you must have learned from spending hundreds and thousands of rupees, because this each homeopaths has worked really hard under the guidance of Dr. Nikam sir, and they have raised themselves to the status of classical homeopath by literally commando training. This is the only word I can imagine, the commando training at Aditya Homeopathic Hospital. So stay tuned every Friday. Now here I'll start my session. Today I've selected a case to discuss with you, is a case of malabsorption syndrome or protein losing enteropathy. You will feel strange about this diagnosis, but as I'll progress with the session, the things will be clear to you. So the thing happened that before a few years, one of my students approached me asking whether we could help her just 3-year-old small relative child. This child was suffering from persistent facial swelling, anemia, poor weight gain. So despite of multiple investigation, they were residing in Mumbai. Despite of multiple investigation and consultation, the pediatric specialist, the exact cause of this illness was not clear. So as you can see here, this is the initial condition of child. So various reports revealed the protein loss, hypothyroidism, anemia, and other abnormalities. The family still had no definitive answer. Now, looking at this picture, you can suspect or you can think that this is a nephrotic syndrome. You know, usually nephrotic syndrome has such a picture. So initially, everyone considered that this is just a nephrotic syndrome with generalized edema, but overall clinic picture and subsequent investigation favored protein losing enteropathy. I'll tell you what is the relation between this nephrotic syndrome, which is quite common condition. Many homeopaths usually treat it. We have seen many interesting cases in our practice, and in of course at Nikam Sir's hospital, we have seen many small kids who are get hospitalized in the Aditya Hospital and get bloomed very well under the homeopathy. But this case is slightly different. It was not actually nephrotic syndrome. It is a protein losing enteropathy. Now I have made a slide of difference between two. In the nephrotic syndrome, the site of protein loss is usually kidney. Okay, so they do this diptych test and all the urinary investigation. Now here in protein losing enteropathy, the proteins are also loosed as in nephrotic syndrome, but the site of protein loss is intestine, that is gut. So the presentation is more common, vomiting, diarrhea, malabsorption kind of. And in gastrointestinal, in nephrotic syndrome, gastrointestinal symptoms are usually minimum. So of course there is failure to thrive, means child just can't grow simply because the vital part of the growth is protein, and that protein is lost, not through the kidneys, but through the intestine at this place. Then of course there is stool abnormalities also in protein losing enteropathy. So it is a similar to the nephrotic syndrome condition where there is loss of protein, but not due to the kidney, but to intestine. Now, how they came to know about this disease? Here are the reports that are in front of you. So these are all done, as you can see, Hinduja Hospital, one of the most well-known hospital in Mumbai, and in the urine, in the stool, there was acidic stool, occult blood, which supported this protein losing enteropathy. Also, there is some rare investigations. Frankly speaking, these are not our day-to-day investigation that we do. But why I presented here is to understand you that this is a protein losing enteropathy, grave condition, grave pathological condition, which has long-term consequences. Now, why this gut or why this intestine is losing protein. That was the question in front of pediatrician. So pediatrician suggested this small 3-year-old child. This is a standard prescription given by pediatrician at Hinduja Hospital. So you can see clearly a clinical diagnosis, that is malabsorption, protein losing enteropathy, failure to thrive, and they advise admission. Means they ask that get this 3-year-old child hospitalized, number one, then do ogiriscopy, that is upper GI endoscopy, then colonoscopy, that is from the anal part. So 2 scopies from mouth, from anus, from CT enterography, all these costing more than 50,000 rupees. So you can imagine the condition of the parents, who are they are like middle class parents who already has so many tests, and this is the condition of child, and still asked by best pediatrician for this kind of test. In this condition, case came to us. Now the patient was living in Mumbai, and patient's relative, who is a student at my clinic, they asked me that this patient can't travel to my city, Satara. So what we can do? Now here again, we have been rigorously trained under the guidance of Dr. Nikam sir that we take proxy cases. Proxy cases is the thing that when patient is not in front of us. But here I would like to tell my dear all homeopaths and students that Dr. Nikam sir has developed a beautiful proforma that we follow. And because of this proforma, we can confidently take proxy cases. So I asked my wife, Dr. Dhanashree, who is also a student of Dr. Nikam sir, we both learn from Nikam sir, to take this case. Now, for all those students who are attending this session, I have pasted in this side the original unedited case record. The only reason of presenting this is that this is the basic efforts that we have been taught by Dr. Nikam sir that you should take while taking any case. Forget about the analysis, forget about the evaluation, but your symptoms, if your symptoms are not on this page, there is little you can do afterwards. There are so many lectures, seminars, webinars nowadays going on the advanced sessions, or you can say some mind symptoms and something. But in this chaos, many times we forget the basics. So that's why I added this slide that you should take a very proper case. I can still remember the nights that I spent at Dr. Nikam sir's hospital, where we used to take this case for hours together, days and nights. And that's why our team has grown in their practice. So the first chip complaint was swelling. As you have seen in this earlier slide, the kids used to have this kind of swelling. Okay. Okay. Swelling. This swelling was actually chronic, but it was waxing and waning. So swelling used to come, then reduced, then come, then reduced. And then, of course, irritability. Now, why there is swelling? As we have seen, there is a protein loss, but not through the kidney, but through the gut. Okay. Now, second interesting part, second painful part for the kid was vomiting. After every few days, there was episodes of vomiting, like after overeating, after night, when she used to feel better only after vomiting. The vomitus contains food, sour odor, and it used to be very, a strong vomiting followed by diarrhea also. So once vomiting stopped, diarrhea started. So in this vicious circle, the kid was unable to gain the weight. That was the first complaint. So vomiting, diarrhea, unable to gain the weight. And because of all this, his blood loss was the occult blood loss that we have seen in the earlier reports. Okay. Yes. Now you can see this occult blood loss here. Okay. So because of this blood loss, hemoglobin was also on the lower side. Then they have to go for blood transfusion, and after blood transfusion, you can imagine 3-year-old child going to all this ordeal, not gaining weight, vomiting, diarrhea, repeated hospitalization, and all chaos. Now, further case details, we have mother who has diabetes mellitus. So in the pregnancy itself, this mother has diabetes mellitus. Father has no any pathology. Elder sister was also, she later became my patient. So she was also a thin build. In the physical, diet was mostly vegetarian, but at the same time, she used to like sweets, milks, sometimes egg, chocolate, and ice cream. Now here again, aversion to milk is also written. It is actually not aversion, but after getting milk, she used to vomit, after vomiting episodes. Then thirsty, urine normal. The perspiration was quite excessive. The head perspiration, especially at night. If you ask me the mental state of this child as recorded by online consultation, she is very energetic, active, and restless child. Sometimes reserved with the stranger, but gradually become comfortable. Very playful, enjoys dancing. But whenever family plan to go out, she become very excited and eager to accompany that. Very like to go out. Then very obstinate. Insist on having her own way. Any contradiction was not tolerated. And when upset, she shrieks loudly. Very irritable kind of child. It was not calm child. In the video also, they have shown me some video where she was jumping, dancing. We'll see this video later. And anger is expressed by throwing things. Constantly seeks attention. She is happiest when held close by mother, like in mother's arm for long period. As soon as she put down, she soon demands to be taken up again. It is like sharing things, irritable, especially following this blood transfusion. I told you that she used to have blood transfusions. Now prefers to be cool environment, that desire fan, dislike covering, and remain constantly active. So this is a state of mind. I initially told the organizer that we will be planning to give case beforehand. Okay. Because once the case is beforehand in your for you with analysis, you can have better understanding. Again, I remember the days I spent in Dr. Amar Singh Nikamsal's Aditya Hospital, that in the whole throughout the day, we used to take the case. And at the night, sir used to analyze the case one by one. So before that, we have to write literally by hand. I think in this era of AI, this after a few months, this writing by hand might be completely end. I fear, but still, we used to write all the cases that we have seen throughout the day, and then we have to make the analysis. So you can imagine, that's why I said it was a commando classical homeopathic training that nowhere in the world we have. Okay. So here also, I provided this case to few groups like our Mission Homeopathy group. If you have gone through this case, please start the analysis. I will share my thoughts, but the main point from where to start, because today's era of this webinars, online meetings, this become very relevant. Okay. So where we should start, body and mind. I like to hear your opinion. So you see, I have a small group of homeopaths where we discuss this kind of teachings of Dr. Nikam sir on non-commercial basis. I have opened this group here. Dr. Mansi, can you see the WhatsApp group? Hello, everyone. So see, these are the analysis done by students. Okay. Now these are remedy names, tuberculinum. Hello, everyone. Can anybody confirm me if you can see?
Yes, sir. We can see the
Yes.
slide. We can see the WhatsApp group.
Yeah, WhatsApp group. So see, this is the kind of analysis that we see nowadays. So these are remedies like tuberculinum, Kalika, Naxomica, here Belladonna, Chamomilla. So I have just put this name. Now again, back to the slideshow. My question is from where to start. See, I expect you to make this session very interactive. Okay, this should not be one way. Everybody, please be active in the chat box, so you'll be learning most. So whatever pattern I have seen, these are the few remedies. You can type your remedy name also. These are the few remedies, the names that I have seen in the group that I have just shown. Okay. Chat is disabled. Okay. Dr. Mansi, can you take care of this issue? Dr.
Chat is enabled. You can put your queries in the question and answer box.
Oh, okay. Some of you has already posted it beautifully. So the $1 million question to start any analysis or to tell you the teachings of Dr. Nikam sir through this case is from where to start. You know, if you see all multiple analysis, mostly they are, yes, family history. Any more options? Family history, body, mind. Here, I would like to start with physical symptoms. Yes, Anonymous says mind, answer is coming. Chamomilla, mind to start. Yes, constitution. Yes, any more options? See, we want analysis to start. Remedy name will come much later. Okay. Because today we are here to learn, here to discuss. I'm here to discuss small my knowledge with you. So I'll tell my approach, whatever I learn from respected Nikam sir. So see, many options are here coming. Mind. Yes, definitely. Mind is super important. But today, most of you are already master in mind. Thanks to the lot of enthusiastic and passionate homeopaths around us today, they are already taking mind to next level. But as far as learning of Dr. Nikam sir is concerned, what I have shown you through this slide is the beautiful balancing of pathophysiology and mind that he has taught. I can say that these three terms, there are n number of revolutions that Dr. Nikam sir has brought in the practice of homeopathy, be it a theory of vital force as oxygen, be it a choice of potency, be it an understanding of miasm through his books, or of course the hospital practice. But with above all, the beautiful style of prescribing that consists of the pathology, physiology, and psychology is something, sir, let me say here that is helping us daily. Every day when we sit in our clinic and we see patient after patient after patient, we thank Dr. Nikam sir that he has given us such a simple method. Many of attendees might feel that this is an exacerbation of a student who is, a lot of become emotional with the sir, but this is not like that. It is a factual. If you also practice with balancing this both angle, you will also enjoy the pleasure of having such a fantastic results. So coming back to the topic, I'll like to start with pathology here because you all are master of mind. Okay. And yes, of course, there is no doubt that mind is super important. Something which Dr. Kent has said the main part of our prescription. But in this chaos, many times we forget the pathology. Now, I want the answer from you. I'm very happy that you are so active in the Q&A section, that how you can reflect the pathology, which is always already in our hand by the senior pediatrician from the Hinduja hospital. How you can reflect in homeopathic prescription? What are the pathological angles? What are the pathological points? What are the pathological rubrics that you can think of in this case? Please, everyone. Yes, many are telling right that irritability is a chamomilla. Yes, you're right. Irritability is a chamomilla. But see, we have to both aspect. Yes. Anyone? Yes, Dr. Kashvi. Kashvi, you are right that it is a gut problem. It is gut problem. You're right. Edema, Pratik, Dr. Pratik. Yes, it is edema. It is swelling of fat. It is emaciation. See, what was the diagnosis? Protein losing enteropathy in malabsorption. Now, I want you to reflect this pathology in the repertory. Is it important? It is very important because it reflects in the entire body. It is not just a local symptom, right? So first part of today's teaching, I'll start that this whole child who is suffering that malabsorption is caused by diarrhea, vomiting, weight loss, low HB protein loss is ultimately causing malabsorption. Now I want reflection of malabsorption in the repertory. So here it is. So these are the clinical points. There are n number of reports. I'll show you if as time permits, okay? But the pathological rubrics that, oh, sorry. Pathological, simple pathological rubric that you can't afford to miss, okay? In the repertoire is a malnutrition. The nutrition which is hampered, yes, Dr. Pooja Oswal, excellent answer you have given. That is malabsorption, protein loss, psychosyphilitic miasm, and remedy also Mercor. That's very nice. Yes, everyone, this is a democracy online webinar. Everyone are here to express their opinion. But remember, we have started individualizing with body. Okay, mind will definitely come in the picture, and we just can't leave the mind. But as Dr. Nikam sir has taught us that it is a beautiful balancing of mind and body that are going to give you the golden remedy and that will work wonder. Okay. So this is directly from Synthesis Treasure Edition. You keep this chat box in the corner. That is coming in way. Okay. Now next is I have taken for your study. So now we have started study from this case. This was case. Let's go to the remedy. Let's go to analysis. But what I want to show as a student of repertory that we have beautiful rubric nutrition affected. Okay. Now again, nights at Dr. Nikam sir's hospital we have spent in reading this Clark and Phatak. So I will assure you that with the due permission of Dr. Nikam sir and Dr. Manish and all the team, Dr. Manasvi and Dr. Suchitra, we have interesting courses coming there. You will be learning this kind of things. And if you're a student, the best thing you can do is enroll yourself to the Aditya Hospital because this is a live training. So such kind of pathological rubric you can see there, learn there. Another is emaciation and atrophy, infantile marasmus. See the group of remedies. Okay. Now the next one is simply marasmus. These all are already in the repertory that we miss. Now second pathology was vomiting. So vomiting milk after, vomiting ambulation. These are the things that are uncommon, peculiar, and that you should not forget as a part of totality. Now, as Dr. Nikam sir has taught us that we should combine this pathology with physiology. Now, as the physiology word come, those who are not aware of our Nikam sir's teaching might confuse, but it is very beautiful word choice, brilliant word choice. The what I can say, this word choice, you see any poet, अगर कोई कवि होता है तो कविता करते वक्त हमारे टीम में भी बहुत अच्छे अच्छे कवि हैं, तो कविता करते वक्त कितने अच्छे अच्छे वर्ड की चॉइस करते हैं, लेकिन निकम सर ने ये 3 वर्ड की जो चॉइस की है वो इसलिए इंपॉर्टेंट है कि दे आर simple and applicable. You can think of in every case that yes, I have chosen this remedy in this case. Is it covering the pathology? Is it covering the psychology? And is it covering the physiology as well? You can explain your modern medicine colleagues. If you explain that we take this physical general, mental general, particular, they'll get confused. But with this Nikam, the words coined by Nikam sir and his nomenclature, you are at the better place to explain them. Coming back to the case, we have to add the physiological points. Again, I'm presenting the original unedited case record, and you can see the thermals that was taken by Dr. Dhanashree, online case taking. You can see the thermals clearly, okay, that we are going to add. Now at your favorite part, okay. Why favorite? Because today everyone is very eager to analyze the case by mind method. And yes, it might have helped. I have learned from many videos of modern mind master. I'm a student of Dr. Nikam sir, but I have no hesitation in telling that I am open to all the sources of Matra Medica, and I keep on updating myself, such as Nikam sir has taught to incorporate Shorten's method also. If you see Nikam sir's book, many times sir very intelligently use this Shorten method. So similarly, I have seen many mind method video and they are helping me every day. So, but here I would like to go with the broader perspective. If you see this child, see everybody, please look at this chat box, because everyone is giving beautiful opinion. Dr. Suvarna Walge, our student, she has see exactly like pathology, physiology, and mind. They has already written. A practitioner from Mumbai, very good practice. I'll request team members to tell more of this pathology, physiology part. Okay, because everybody will learn from you. Everybody is not fortunate like us. Let me say here clearly. Everybody is not fortunate like us to get trained directly under the Nikam sir. So it's our job to forward the message of Dr. Nikam sir. Okay, so the question is, what type of child? What type of child this is? Simply, okay? Broader perspective. Okay, time is running. I'll keep it forward. So simply, yes, it is an irritable child. It is an irritable child. It has carried desire. It has travel desire. Any confusion about this? Not at all. Okay. Correct. Yes. So I will like to start from scratch. If you open the Kent, if you open simple rubric, mind irritability children, you have these group of remedies. Chamvilla, Sina, Graphitis, Maccarp, Calcarea Phos. These are all irritable children, and we should know this very well. Okay. So now I have summarized this case as per the teaching. Yes, Rishal, thank you for your reminder. Yes, time is going. This is the second last slide of the case session, and there are few slides about the remedy. Okay. So right now in front of you, you can screenshot this. You can remember this, that this we have classify the important peculiar symptoms of pathology like malnourished child, no weight gain, anemic tendency to omit diarrhea. We have extracted the physiological symptom, that is hot, so abrupt. Okay, all are here. Dr. Mansi, was it from my side or technical issue?
No, sir.
Okay.
So your video is visible
Yeah.
and connection is perfect.
Okay. There was some. Now I haven't shared. My slide is not visible, right?
Yes, sir. Currently it is not visible.
Now.
Yes, it is visible.
Now.
Yes, sir. Visible now.
Yeah. So I have gone to this. And see, in this 1.5 hour or hardly 1 hour, it is not possible to tell everything. And I'm telling you that this is just a tip of iceberg. What we learn at Dr. Nikam Sir's hospital is unlimited, uncountable. Okay, this is just a tip of iceberg, but still I'm trying my best to give the thought process that I learn. Okay, I'm not saying that this is a final teaching of Dr. Nikam Sir. There are many senior that are coming in next sessions that will be telling you in the better format. But in this child, after 30 to 45 minutes of online case taking, proxy case taking, this is what we got pathologically, physiologically, and psychologically. Now, I will take you again to our case analysis. This is the WhatsApp group that I am running from more than 2 years, and I have shared more than 60 cases completely non-commercially. Okay. So here you can see beautiful analysis done by many homeopaths. Like you can see Kalika, Naxomika, Belladonna. See, beautiful analysis by Dr. Aniket. Mind, amusement, desire, anger, biting, carried, clinging, playful. Perfect analysis. Completely missing the pathology and physiology, isn't it? So the message is that, of course, you take all the mind. See, now here they have done better efforts. And of course, our student, Dr. Suvarna, Dr. Megha Patil, see this analysis. So many student has done analysis beautifully. Okay, see, handwritten analysis. Okay. So why I'm showing you in the upcoming session, you are expected to put your effort. Let's do it like a workshop rather than just one-way lecture. So combine all this, we'll go to the remedy. But before going to the remedy, of course, after giving remedy, the result was really surprising. Hemoglobin, which used to be just 4 or 5 something, that rose to 8.8 after subsequent follow-ups. Even the protein loss, the protein, that was also normalized. Then IgA antibodies, that is allergy count, that is also reduced. Then thyroid, she was even showing the symptoms of thyroid. Let me clear, no modern medicine was given, because modern medicine doctors were not sure of diagnosis. They were asking for this copy and that copy, and that was, so we stopped that. The thyroid also came normal. Here I would like to show you the patient. I'm sure that you are very eager to see the patient. There is small 4 minutes video which I'll show you, where you will get a glimpses of this patient. And actually I have made this video, and if you are live, you can see this video. After, when we will posting this session online, this video will be removed as the privacy concerns.
Hello, homeopaths. This is Dr. Rahul Jadhav.
Dr. Mansi, it is visible video?
Yes, sir. Your video is visible.
Okay, thank you.
But again, back with fresh case of a small child with malabsorption syndrome. This is a very strange case, as the child was seen by multiple pediatricians and super specialists without any relief. The main complaint was he has severe edema around the eyes. Even some of the consultants from Mumbai told that.
Sorry to ask again, is it visible clearly? Hello? Is video is clearly visible?
Yes, clearly
They
visible
just
and
can't
audible.
diagnose her disease. Okay. And then told next investigation, which is causing more than 40K. Now you can see pathetic condition of child, and they were just unable to diagnose it. As we always do in our clinic, on phone, Dr. Dhanashree has taken in detail consultation. You can see case details, beautiful case taking with various minute details such as vomiting, character of vomiting, edema, the symptoms which aggravated her complaints, her desire aversions, her stool urine habits, and most importantly, state of mind. You can consider the challenge of taking case of such a small child, that too on a phone consultation. But as we have developed a detailed proforma, in such cases also we can give justice to patient by collecting every minute details. So after going through this details, I try to make a totality based on the characteristic symptoms of body and mind, and the single remedy was given, chosen based on, as I have told you, pathophysiology, thermal and miasm, and the response was simply amazing. Okay, as this small child who is residing at Mumbai has gone through many multi-specialists, his improvement was not less than miracle to us. But we were not stopped there. We asked her to do all the reports again, and found the significant improvement in hemoglobin, in her IgA antibodies, even her, most importantly, protein count, which used to very high previous reports, which got normalized. So this all once again showed us the efficacy of homeopathy in such a challenging cases. Even thyroid is normal, which used to be high. And again, all the credit goes to the beautiful way of as guideline given by Hahnemann. Let's see the testimony.
Okay, so this was small testimonial. They are a little bit, you can see camera shy, because I told them that please record video and send me. So, but I think you must have got a fair idea that what's wrong with this kid and how homeopathy helped him. So let's back to the analysis. We are running out of time. Any final ideas about the remedy in the chat box? And we will go to the concluding session. I can really see the so many remedies coming up. Dr. Santosh Ranade, my dear friend, is here. Oh, it's very nice choice. Mac carb, calcarea carb. Okay. SAR child, Mac carb again. Chat disabled. No, chat is fully enabled. So as you can see, belladonna. Okay. See now, Ajay Pawar. So many are yes, Dr. Ajay Pawar, Dr. Vishal, and Dr. Seema, Dr. Sadhna, Aniket, and many others has rightly pointed out the remedy used was Sanicula Aqua 30. Okay, Sanicula Aqua. So it is many, those who said belladonna, those who said chamomilla, those who said Mac carb, and they will understand after my few slides that they were really very close. Okay, so you can see how we have made the totality here. First characteristic of vomiting, that is forcible in children, then clothing, that is, then of course anger, irritable children that I have seen, contradiction, obstinate, carried desire, traveling. This is a unique combination. Okay, now many times we get confused with thermal. There are so many chili remedies that are coming from belladonna to magnesium carb. Here you can see a screenshot from book where clearly Sanicula is written under the hot. Now, can you tell me from chat box which book is this? Anyone? Where it is written very clearly about the thermal state. Which is this book? If anybody knows, from more than 300 attendee. Wow. Yes, Onkar. Yes, Dr. Santosh Ranade, Madhuri Bhandari, and so many know that this is a yet another contribution, path-breaking contribution, practical contribution that you can just keep on your desk and refer daily. This is Dr. Nikam sir's book, that is Thermal Matra Medica. Okay. I know many are having many questions about how this we have given Sanicula, and this will be clear from in next 2 minutes by my next part of my presentation, that is about the remedy, and then we will go to discussion. So now we are going to the remedy part. I hope till now everybody must have enjoyed the session. Is it clearly visible? In the chat box, please, everyone. Okay. In Q&A box, yes, it is visible. Okay, so Sanicula Aqua. Sanicula is very interesting and very strange remedy. Why? You will realize after few slides. So Dr. Emil Tyrer has famously said Sanicula is a remedy that happens to be picked out from dozens of other better known remedy and assembled bewildered. ऐसा लगता है कि बहुत सारे remedy से symptom collect किए हैं और mix करके डाले हैं. So here I have attached the part from N.M. Chaudhary. Okay, and N.M. Chaudhary, it is clearly mentioned that this medicine is prepared from the spring of water of Sanicula spring. Spring म्हणजे झराचं पाणी. हिंदी में झरना, झरने का पानी. So the mineral water contains natramur, calcarea carb, calcarea sulf, animula, magnesium. So those who are saying calcarea, those who are saying magnesium are not wrong. But again, we want the totality. Okay. There is interesting word line that I came across, that Jonathan Shore, he's a student of Dr. George Withelkos. He said that if you want to make combination of remedy, God has his own combination of remedy. The context was there was era in between that people were making some strange combination, that platinum, fluoraticum, muraticum, then some calcarea, muraticum, platinum. So these were there was trend So about this trend, he said that why you are making such strange combination? The God has his own combination. Okay. Now in front of you are the original constituents and of this wonderful remedy, from natrum mur to calcareum mur to mag mur to kali bichromicum, kali sulf, natrum bicarb, silicia natrum, and so on. These are all inside this wonderful spring water. Okay. Now interesting part is how it was proved. Now in the proving, the whole family, the entire family drank this spring water. You know, now Kumbh Mela is coming up soon. So there are many anecdotes about the medicinal property of the water at many locations. बहुत सी जगह ऐसी है जहां का पानी पीने से, वहां से नहाने में ऐसे सुनने में आता है कि उससे कुछ मिराकुलस क्योर हुई है. अगर हम देखें तो उस साइंटिफिकली देखें तो उस वाटर में, if you see the scientifically, in that water there are some constituents that are in turn causing this kind of miraculous cure. So here what happened, this entire family drank this spring water, and that is not for one day, not for 1 month, for entire 1 year. And after some 5 years since the proving was made, that my family still suffer from the effect. So ये प्रूवर का कहना है कि उनकी पूरी फैमिली उसके इफेक्ट से सफर हुए थे. So basically source is waters, mineral spring. So ऐसा है, is it like that only this sanicula is prepared from spring? Now here I would like to ask our attendees, anybody knows any other spring water that is also used in homeopathy as a part of medicine? क्वेश्चन समझ में आया? क्या होम्योपैथी में सैनिकुला छोड़कर ऐसे कोई झरने के पानी है क्या जिसको पोटेंटाइज किया है और जो एज अ वाटर यूज करते हैं, एज अ मेडिसिन यूज करते हैं? एनीवन? यस, विजनेडेन. एनीथिंग एल्स? गुड, डॉक्टर सादिया. I spent my 1 hour in searching the next slide. This slide is, it took 1 hour. Okay. So in Australia, there is one Justin Aqua, which is used medicinally. In Czech Republic, this Carlos bud. Carlos bud is not such a rare remedy. It is quite used by many homeopaths. Carlos bud has a good nature like Ignatia. It is close to Ignatia, Carlos bud aqua. Then there are so many aquas like in France, Germany, USA, Italy. There are so many spring waters, and I hope our local team members can think of made in India, like make in India spring water. They can potentize Nashik, Kumbh Mela and come up with a beautiful remedy. But as of now, we have this Sanicula aqua. Synonym Sanicula spring water, Ottawa. So Ottawa is the place where this specifically this water is taken. And again, constituents, it is a combination of all constituents. So see the beautiful sphere of action. It is not a rare remedy. It is a polycrest, fully proved, well-proved remedy. When I speak the word well-proved, again, Dr. Nikam sir teaching come in mind. Yes, aquamarina, somebody said, but aquamarina is actually marine water. This is not spring water. Spring means झरने का पानी. Okay, the answer is coming in the chat box that I answered it. So sphere of action is on the nutritional, gastroenteric. Yes, Kukumchak. Vishal has given this answers. Kukumchak, Sadia, and more. Yes, it is also there. So you see sphere of action, nutritional, gastrointestinal. See, if you understand this remedy better, you will using it more often, because we see so many of kids who has this perspiring head. Is it common or uncommon? It is quite common. But along with calcarea, along with silicia, along with sulfur, we have this Sanicula aqua. Okay. Now the clinical picture is typically a ill-nourished, weak, scrofulous child, a pot-bellied, hair dry, lustreless, skin hangs in folds, the dirty face full of pimples, looks thin and cold, like you can imagine, also correlated with today's case. Now here I have collected few keynotes. The marasmus, of course, specific remedy for marasmus, specific remedy for malnourished child. As I just told you, that sweaty headed children with defective assimilation. It is not just intake, it is assimilation, means eats well but emaciate. You know, you must have heard this rubric, eats well but emaciate. For you, I have the repertory open, but I know we are running out of time. So I will not devote more time, but just see, this is a live repertory in front of you. So you can see in the Fatak, the vomiting of milk, there are only 8 remedies where you have saniculols, right? Then eating, yet emaciation. I'll quickly show you if you can make it. Yes. Can you see the repertory clearly? You can see sanicula here. Eats, bed, emaciation with ravenous appetite. Here it's in children. Okay. How many remedies? Only 21. Here you can. In infant, again sanicula. So this is the important part. If you ask me a single important rubric in the entire sanicula, and if you see the mind method videos of this, they have emphasized more on nursing, wants to nurse constantly at times. Again, I can remember the beautiful cases told by Dr. Nikam sir in his practice that there was a kid who was harassing this mother with constant nursing. So basically they have defective nutrition, and because of obvious things of defective nutrition, the body obvious solution is cons to be nursed. Okay. So remember this rubric. This is very important key part. And of course, you must have studied this keynote that craves for bacon, ham. Again, magnesium comes close to this. So we are concluding in few slides. I know the time is up. I'll take little fast. So instability of purpose. This is the keynote that is mentioned by Fatak, that constantly changing occupation, wandering thoughts. Again, it will might look like chamomilla, might look like pulsatilla, and you will get confused. So it is a overlapping of different remedies, and that's why many times we miss this remedy. It is like a nosode basically, you know, nosode, medorinum. It looks like lycopodium, it looks like pulsatilla, it looks like sulfur. There are some symptoms of combination, and then finally the patient comes to be medorinum. Similarly here, the kid looks like chamomilla, looks like natramid, looks like something magnesium, and finally silicea, calcarea, and it came out to be sanicula aqua. Now you see, mind obstinate, kicking and crying and wants to be carried. What remedy you will remember? Obviously chamomilla, but it is not like. Next, general modalities. I'll skip this part, but vomiting emulation is there, which is exactly matching with this case. Again, sweaty headed children with defective assimilation. In one line, you can understand this case. Patient, sweaty headed children with defective assimilation. Again, calcarea, silicea comes very close. Offensive discharge, very offensive patient. We have calcarea, graphitis, medorinum, tellurinum, and sanicula, like eczematous fluid. Then scalp is offensive, foot is offensive. Fish brine odor, fish brine. Remember this keynote. Gastrointestinal symptoms are very important. If you see, I have compiled the vomiting rubrics only from Kent, Fatak, infant. So in this was the small child who is vomiting. So vomiting in children, vomiting in infant, directly remedy is sanicula aqua. Okay. Stool characteristic, there is constipation, there is diarrhea, exactly like in this case. Bashful stool. Which remedy we will remember when we say bashful stool? Anyone? Which remedy which comes to our mind when we say bashful stool? Be active in the chat box. Yes, silicea. Good. So it is like that. Pediatric keynote we have already covered all kind of. You can read at your. The causation, see how this case closely related. The mother was already having diabetes in the pregnancy. Obviously, the child was of a diabetic mother. And the causation here is poor, inadequate diet, strains. Differential diagnosis, of course, sanicula versus silicea. In the share features, I put irritability, but irritability is not main presentation of silicea. Desire for eggs, dreams of robbers, perspiration, these are common things with silicea. But sanicula child is way more irritable, way more unstable. Rather, silicea is more shy, timid, hesitating. Now the main comparison. If you see in the chat box in our WhatsApp group, the main comparison was between Sanicula and Chamomilla. Why? Because there is greenish diarrhea, there is a changeable, there is stools putrid, burning of palms and soles. Again, I remember cases in Dr. Nikam Sir's hospital. There was a patient who was lying somewhere in IPD. Sir told us to take some acute case. One of our team members went and take an acute case. Sir given, the patient was having burning of soles. Sir has given dose of Chamomilla, and after few hours, like in the morning, so we were used to be there full night. In the morning, Sir again asked, see whether that patient, how that patient is doing. Then that intern rushed and he was sleeping calmly. The Chamomilla was given by Sir and he was sleeping calmly. So burning up soles is also a great characteristic of Chamomilla, irritable. Now here is important words that you can literally write down. Sanicula is a chronic of Chamomilla. Sanicula is chronic of Chamomilla. So exactly like Chamomilla, but chronic. Why chronic? Because more depth of action, more miasmatic, you can say, array of prescribing we have with us. Calcarea phos. Now, if you see the rubric, nursing desire to be, there are only 2 remedies. Now, interesting part, in the synthesis repertory, you will not get this rubric. Unfortunate part rather. Constant desire to be nursing, nurse desire to be. This rubric, ये rubric complete में ही है, synthesis में दिया ही नहीं है. And again, in Nikam Sir's hospital, we always use complete repertory. तो देखो सर ने हमारे लिए क्या किया है, एक ऐसा simple, easy, ready to follow path दिया है. इतने सारे repertories है, people keep on doing trials and errors from entire life. I'm not criticizing anyone, but still. But Sir had chosen just few tools, and these are the tools that you can apply. And today, after 10 years of practice, 15 years of practice, 20 years of practice, we are still using that tools. That tools means complete repertory, synthetic repertory, Kent repertory, and the way of prescribing. Coming back to the topic, मेरा कहना ये है कि ये जो rubric है, constantly desire to be nurse, ये synthesis में दिया ही नहीं है, complete में दिया है, only 2 remedies, Sanicula and Calcarea phos. Now I'll tell you interesting part. इस पेशेंट की एक सिस्टर है, ये जो छोटी बच्ची थी उसकी एक सिस्टर है, मैंने बताया. She was also became my patient later, and she was helped by Calcarea phos. So you can imagine the beauty of homeopathic proving that close remedy are also found to be sisters, like Sanicula and Calcarea phos. So here is comparison. Both are restless, both desire weapon, both has sweaty scalp. But the difference is that Sanicula is very irritable, like cranky, irritable, and Calcarea phos is, very soft person, soft kind of. Tone is soft, like weak, soft. They don't have strength in the body. And this is the difference, okay? Now we will Calcarea carb. Now rest difference you can see at your home because it's already tuberculum, Sanicula. This is some of you has told the tuberculum, but here is differentiation. Natrum mur, of course, both are very similar, but differentiation in main nature only. Mac carb, my friend Dr. Ranade sir has told about this Mac carb in the option, which is really very close because both have mid desire, dreams of robbers, marasmus, uncovering feet, perspiration. But again, Mac carb child has this kind of inert, shy, carbonicum element. Carb is dull, sluggish, like Calcarea carb, Mac carb. Though Mac carb has a shade of Chamomilla like irritability also. Don't forget that. Mac carb, there are most of Mac carb as shy, timid, but many author has given Mac carb has a like Chamomilla also, irritability. Okay. Then Medorinum. You can find this Mac carb in. These are the books that is recommended by Dr. Nikam sir day in and day out. First is Clark, second is Phatak. Borland was, addition by me, you can say. Borland has very beautiful children's types. This is a must-have book if you are a practitioner of homeopathy. Children type by Borland. Here I have mentioned that, and Kent's and Boric. Okay. So summary, this is the last slide of today. In the summary, the mind, You should remember irritable, cranky, with fear of dark, travel desire, children who are obstinate, aversion to touch. Like you'll remember many remedies with each keynote. The marasmus, emaciated child with bashful stool, changeable stools with sweating, lot of offensiveness, and general vomiting, emulation, chronic of chamomilla. I think this is more than enough. It's more than 1.5 hours that we are discussing, and more than 250 homeopaths are still there. Those 250 are still there. I can say that this is just a trailer. I'm just a small part of the team. More Dhurandhars are yet to come to present. Like in next lecture, there is Dr. Sai, who is also running an homeopathic hospital at Nagar. I had been to his hospital, a wonderful practitioner, and you will be hearing his next lecture. Then we have Dr. Mukesh, Sheetal Kumar, Dr. Manish himself, Dr. I can't take names of all, but stay tuned. If you have any question, please last 2 minutes. And of course, your reactions are very precious for us. WhatsApp group, yes, we will set up WhatsApp group new for this mission homeopathy. And with this note, I would like to end my session. Thank you for 250 people for patient learning. I hope you have got good idea, small idea of this wonderful remedy, Sanicula Aqua. Over to Dr. Over to Dr. Tyagi. Yes. Your questions important. Anybody want to unmute and tell?
Yes. Any doubts from the session? You can please ask.
Yes.
Everyone is saying thank you so much for this nice webinar.
30 potency beyond doubt. 30 potency beyond doubt. If you want to have a question about. No any anti-miasmatic. We don't have any anti-miasmatic concept as such. Every remedy is complete in itself. If you read tuberculinum from Kent, Kent has given clearly that don't use tuberculinum like a nosode. Use it like a remedy. Don't use nosode like a nosode. This is a famous line by Dr. J.T. Kent. We used it as a single remedy totality, not anything else. Okay, if anybody has any question, I have typed my number. You can definitely contact me for any more question. Repetition on and off, you know, after every few days, like we do repetition on and off. This is important words, like when there is recurrence, when there is pains, in the span of 2 years, it has repeated few times, you can say. Sometimes he has got, you know, some traveling and then again recurrence, then we have given it again. Potency 30, no doubt about that. Yes. Okay. I think this is more than enough for today. More than 200 still there. Dr. Mansi, anybody want to unmute himself, and is it possible, or we can conclude also? Just with one line, this is just a trailer. Many amazing homeopaths are yet to come. Yes, Dr. Srishil, thank you. Thank you for all team members to being here. Dr. Sheetal Kumar, Dr. Srishil, Dr. Manish, and many are here, I know, but I can't see them properly. They are the pillars. In the future, we can take some offline sessions also. Yes, to join WhatsApp group. Dr. Vishal, you can type my number if possible, because I can't type. I can give answer only. Name and number. Yes, I'm overwhelmed by your responses. See, basically, we are planning to set up a different WhatsApp group. Dr. Mansi, is it possible to have this contact of the attendees so that in future we can set up a WhatsApp group?
Session this we uploaded on YouTube Homeopathy 360 in collaboration with the Aditya Homeopathy Mission. In the video description we can share the details around that. Then get connected with Dr. Rahul, and I guess it's time to wrap up after
Yeah.
this insightful session. And no doubt, this session provides so much knowledge to all the students and practitioners. We are very lucky to have you, sir, on this
Thank you so
today's
much.
platform. And thank you so much for giving us your valuable time.
Yes, thank you, everyone.
And definitely, after this session, we are having another very wonderful session in aligned with every Friday. We are going to have this session
Yes,
in
definitely.
this webinar series. So be attentive and be active for the next session.
Yes.
All right. So thank you so much.
Thank you so much. Bye-bye.
Bye bye.